So initially we'll speak to the patient, try and find out if they've got any problems or concerns, and then we'd like to try and address those first before we kind of move on. The first thing we'll generally do once we're looking in your mouth is we'll carry out an oral cancer screening, so just checking your tongue, your cheeks, the soft tissues in your mouth just to see for any abnormalities. And then once we've completed that, we'll check that your gum health is okay. So we're looking around trying to see if there's any signs of gum disease, and if there is, kind of what stage it's at. So we'll always feed that back to the patient just so they've got an idea of what's going on as well. And then after that, we generally will spend quite a bit of time going through what you do at home, so what the patient's routine is brushing wise at home, because that actually really impacts your oral health. So we tend to spend quite a while discussing that and making any recommendations or tweaks if need be. And then finally we'll move on to the actual treatment. So it's a combination of using the ultrasonic scaler, which is water and vibrations, and the air polisher, which is basically water and powder, and that gets blasted at the teeth to remove any particles. So that's generally the finishing off bit. If your oral hygiene's excellent and you've got no history of gum disease and it's all fine, then those are the patients that we would recommend coming like once a year minimum. For the ones that are generally stable, they might have had a bit of gum disease in the past and that's sort of resolved or is well maintained now, then that would generally be coming every sort of 6 months. Whereas we would say come every 3 months a bit more regularly for the ones that have got gum disease that's still quite active and ongoing and really need to see them that little bit sooner. Obviously you get the odd patients who, they want their stains removed, so although that's not such a essential treatment as in treating the gum disease, but patients more of like a cosmetic treatment. So we would give you our recommendation based on your oral health needs, but you could always come sooner if you wanted your stains removed and wanted a bit of a freshen up and a brighten up. So with that one, so basically every hygiene appointment is going to be slightly different based on the patient because no mouth's the same. So we'll assess and treat as needed, and that can vary time wise, but as a general rule it's about a 40-minute appointment, and that kind of will bring in all of the aspects that I mentioned earlier.